Hi, my name's Steven. I'm an interventional tech at North Florida and a student at Santa Fe College. This is my presentation on physician assistants and what that involves. There are three sections. The first is the career, second is the employer, and third is current issues. First of all, we'll look into what a PA is. PA stands for physician assistant. They are healthcare providers who can practice medicine underneath the direct supervision of a physician. This means that they can work in almost any field, anywhere from orthopedics, pediatrics, general surgery, emergency medicine, radiology, and many more. Their scope of practice is almost endless, which makes it very appealing to many students who want to go into some form of healthcare over being a physician, because they have the ability to transfer between many different fields. The field I would like to go into would be PA in radiology. And as a radiology physician assistant, my responsibilities would range from many similar to that of a regular physician assistant in general medicine, which involves rounding, which is where you go up and actually see the patient, talk to the patient, and get a good history. Obtaining history and physicals, which is basically just evaluating the patient as a whole, their health, currently, what they have in their past, and so on. As an interventional tech, I do have some experience in radiology as well, because prior to becoming an interventional tech, I was a radiology tech, and interventional is a further field. So I would love to get work in radiology, because I got into the imaging field because I love imaging and I love working with x-rays. And as a PA, you would work with x-rays, MRI, CT, ultrasound, and many other different studies that we do down in radiology. So by being a PA, I'd be able to be a provider and be able to interpret x-rays and MRIs and use them to help patients. Performing procedures which include anywhere from assisting the physician during angiographic case to performing PICC lines, which are peripherally inserted central venous catheters. Second, moving along, we have what an average salary is for a PA. Working in a hospital, state or local or private, you make around $89,000. A higher end of that is $10,000, and the lower end being $80,000. A lot of this is affected by what field you go into. As a PA in general surgery, you would be making something higher because you're working in a more specialized field. If you were just a general physician and worked as an internal medicine PA, you'd be making less because you don't work in such a specialized area. By working in an outpatient care center, which is the second one, you make a little bit less, but almost as much as you would if you worked at a hospital. Physicians' offices, again, you make a little bit less money because they are smaller. Working for the government, you also make less. The least would be working for a college or university or a professional school, where they would pay you the least. Moving on, to become a PA requires a bachelor's degree. It can be in any bachelor's of science. It doesn't really matter, just a matter of fact that you need to have that degree along with other prerequisites like organic chemistry. They do like for you to have a healthcare background. With a healthcare background, it looks good if you have something that's more involved than just having volunteer hours. A high GPA, of course, would make you look very good when you're trying to get into PA school because they want the best of the best. Once you're actually in PA school, it's either it can be a master's degree or a bachelor's. There are very few bachelors that they do offer as a PA, but some schools still offer them. Most are a master's degree, and they are starting to make more head toward it being a doctorate. Once you're done with PA school, however you go about going to it, whether it's a bachelor's, master's, or doctorate, you, to be able to practice, have to pass the national exam, which is given by the National Commission on Certification of Physician Assistants. By passing their exam, that would allow you to practice in almost any state in the country. Some still do have their own standardized exams, but the majority of states follow the certificating commission. The outlook for the career is great. It is actually one of the highest growing fields. The U.S. Bureau of Labor expected to see a 30% increase in the field from 2010 to 2020, which is quite a jump, almost double what most fields expect. And so that pretty much sums up everything that we need to go over for the career itself. Then the next section we're going to look at the employer. The employer that we're going to look at for healthcare is North Florida Regional Medical Center. They are a full-service medical center offering care in both general surgery, cancer treatment. They're a nationally recognized cardiac care center. They also have a acute care center, which is also known as the ER. They're well known for their bariatric surgeries. They have a dedicated women's center. The hospital in total has 353 inpatient beds. They also have a large outpatient care center focused in each different department. So there is an outpatient general surgery, outpatient cancer treatment, and outpatient bariatric surgery centers that really helps patients with both hospital care and when they go home. North Florida has been recognized recently by the Joint Commission, which is a government-run agency that goes around grading hospitals on their level of care in certain areas. North Florida has the privilege of being highly rated in treatment care of heart attacks, heart failure, pneumonia, surgical care, children's asthma, hospital-based psychiatric care, and blood clots. The outlook for the hospital, they have currently a $62 million expansion that is taking place and is expected to be completed by the end of 2013. It's going to be adding 92 more inpatient beds, a level 2 neonatal intensive care unit, and of course, with this expansion, they will be adding jobs from the base all the way up to high level. So from janitors all the way up to physicians and department supervisors. North Florida is an HCA facility. HCA is the Hospital Corporations of America. It's a national company that owns a lot of for-profit hospitals. Their great thing about HCA is they are a patient-centered care area, so they really care about how patients are taken care of, because being a for-profit hospital, they want to encourage people to come back. They want to have people that have a good experience at the hospital. North Florida in the news recently has been recognized by the Joint Commission for being a top performer for 2 years in a row.